Good evening, everyone. I'm Scott Schwartz, if you don't know who I am. And tonight we have a very special guest, Dr. Sodi. She's a board certified orthodontist and co-founder of Define Orthodontics, located in Dallas, Fort Worth area. She's a leading provider of InSmile Braces, and her practice integrates advanced digital technology and customized appliances. Dr. Sodi frequently lectures on airway-focused orthodontics, growth and development, aesthetic treatment options, and practice innovations. This evening, she will share how InSmile braces can serve as a treatment modality that is invisible, predictable, and profitable for orthodontic practices. I would also like to personally thank Dr. Sodi for believing in me and my team as we work together to bring this technology back to orthodontic practices everywhere, providing patients with one of the most aesthetic treatment options available. So later on, you could type in your question and answers or wait to the end and to ask Dr. Sodi any questions or any questions you have from myself. Thank you and enjoy the lecture, Dr. Sodi.
All right, everyone. Thank you so much for joining us today, this evening. It's a beautiful day here in Dallas. So we are going to start with this. Like, this is something that's very close to me because I think like incorporating in Smile at the time that I did for my practice was very pivotal for the growth of our practice, and hence I feel very passionate about using this product in my practice. So feel free if you have any questions, anything like there's, please feel free to like put it in the question and a Q&A section, and we'll absolutely have enough discussion. Like, we want to have a very open discussion about this topic, clinical, business side of things, whatever questions you may have. Okay. So thank you so much, Dr. Schwartz, for a very nice introduction. But yes, I practice in Dallas area, and for anyone who is familiar or not familiar with Dallas, it is a pretty saturated market, just like any other major metropolitan. And I do feel like in order to create a niche for myself, like we had to, I'm a co-founder. My husband is my partner in the practice. We do it together, and he's the business mind behind the practice. And we had to do something which was different. So that's when we ventured into what we call, the era of lingual braces. Basically, it all started with in brace, and now we've kind of call it InSmile. And I actually feel that my confidence in the product has gone up since since all that big major transition happened in, this past year. And I feel like that confidence came because I know the people behind the brand were, Dr. Schwartz and Dr. Lee, who's like taking care of all the clinical side of things. I feel like they are orthodontists who are peers just like me, who are invested into the product as much as I am. So I feel a lot more confidence in the product at this point. So lingual braces, people always like, I've had this conversation like, okay, what is the main, like, just like any other orthodontist, all our websites, if you go there and you're like, hey, what is the product that you guys offer, usually, like, it is so interesting to me, like, you go to a general dental practice website and there'll be like 15 different things that they do, like, hey, we do dentures, cleanings, this, that, blah, blah, blah. Like, they'll make up, of course, a lot of other stuff, but there's like so many pages. And then you go to an orthodontic office and there's like two things given: braces, aligners. That's pretty much it. Sometimes people will write retainers as an option of, treatments provided or services provided. So I feel like there has to be like something else beyond braces and aligners. And that's where the lingual braces come in. And lingual braces have been around for a while. Like, it's not something that it's completely new to us, but I feel like the products that came in earlier on, they were not so much user friendly in, like, on both ends. Like, the doctors were not happy and the patients were not happy. So it kind of ended up being a situation where nobody is happy, but they were just doing it, like, not completely happy or satisfied. So they never got the kind of popularity that I think they deserved, to be honest. But there is a good set of population that absolutely want straight teeth, but they don't want braces. They don't want to look like schoolers, and they have kind of tried or may not have tried clear aligners, but they've failed. They're not compliant with aligners. And I feel like that's the set of practice or people that are looking forward to this. Like, honestly, for us, I feel like, the orthodontics has changed so much, so our treatment mix needs to be changed accordingly as well. Like, we need to provide the services or the technology that makes it easier for people to adapt or to get new things. People want invisible treatment, people want discreet treatment. And clear aligners, if you tell them, hey, okay, if you want clear, like, just clear aligners is the only option. And yes, there are different brands of clear aligners, but they're pretty much the same product. And also, orthodontists, as orthodontists, we want control. And we feel like, I have said myself in so many different consults, like, hey, I want to be the control in the control seat here in your case because your case is a little bit more complicated. So I want to do braces for you because I want to be in control. And we feel that we're not in control when we're in aligner treatment for our patients. So I feel like InSmile is such a beautiful combination of both. Like, patients want that clear option, and in orthodontists, as orthodontists, you want that control. And it's a beautiful merger of both things. So, and I feel like that's such an important thing here. And for us, when we were starting our practice, we entered into the DFW market, when it was like pretty saturated. And I was not getting any referrals from, pediatric dentists or general dentists around me. Like, I was a newer ish orthodontist who has come in. They have not seen my work. Nobody wants to refer too much. The referrals were very minimal. Like, if that depended just on referrals for our growth of the practice, we would not have been where we were. So it was actually my husband's idea, where he's like, okay, let's try the social media marketing with this new product. And then I was introduced to, at that time, Embrace, from one of my actually seniors in my residency program. And we were like, okay, let's try this. So I feel, especially for, I'm not sure out of the attendees how many are newerish practice owners. Like, I'm under 5 years of practice ownership, and I feel like, as a newer practice, it was such a huge practice differentiator, because then, we did so much marketing that it kind of helped bring people in without us having to, like, look for referrals. So it was a huge practice differentiator, I believe, um, which worked out really for us. So not everyone will have lingual braces, so not everyone, will be a candidate for lingual braces. Let's say that too, because there's a very special subgroup of people who know and they really want it. Like, and not everyone is going to be, as an orthodontist, they're not going to be very confident in offering lingual braces too. But that's where I feel like I went, when you go all in and you lean in and learn the technology. And honestly, I feel like people think that there is a very steep learning curve. It's actually not. It's honestly, and we'll go through this, and I'll help try to answer any questions if people may have, because those are the most common questions I've been asked before. Like, hey, I feel like it's such a hassle, or it's going to be such a steep learning curve. It's not. It's just like any other digital planning platform. Like, you digitally plan the movements of the teeth. Like, we've been working with aligners for so long, and we've been moving and tweaking the teeth, and we know what movements can happen. So honestly, it's such an easy like movement into it. So, and also, for me, when we were starting as a newer practice, I had so much chair time, and I feel like, even for established practice, like, even if, let's say, like, I am busy now. So I don't think that a new technology, when it comes in, it'll be as quick or easy adaptation. But even at this point, like, adaptation of this technology should only, like, it's not like, oh, you have to shut down the whole clinic and kind of do something. You can absolutely develop the systems to make it work for your practice. If you're really, you can lean in on the technology. Like, there's so much support that's provided. And also, we'll talk about a little bit more details about marketing, because your marketing will not look like anybody else's marketing. And I feel like that's what helped us with our practice to kind of grow, because our marketing was completely different. And so we'll talk about what is the case selection wise, like we were talking about, okay, not everyone is candidate for lingual braces. So let's talk about, okay, who is the right candidate then and who is not. Adult crowded cases, people who've had braces before and have had relapse, did not wear their retainers, may have tried aligners, have tried Smile Direct Club when it came around and failed. The treatment did not go anywhere. Or professionals, like we get so many patients who are actually at very high. We're getting this subset of population where they're attorneys, they are doctors and physicians, they're people who are. I have a patient who's like who's a TV presenter. They're on radios. They're on in front of the cameras a lot. And all those professionals, they hate the look of aligners, or they're not compliant. One of my kids' friend's dad, like I've seen aligner attachments on his mouth forever, and he's like, "Yeah, I don't wear them," and his teeth does not look good. But those people are the people who are looking for a solution. Those are really good. Like some, people who have tried aligners and failed, they do so wonderfully well with this. And then there are some cases where we say like, okay, this might not be a good case. Like something about the mechanics of InSmile braces that we've have kind of found in my practice, at least, it's really good for, if we have like spacing in the flared out teeth, like it brings them back. Like the torque control is beautiful with InSmile. So if they're super narrow arches, sometimes I feel like it doesn't get, there's crossbite. But in those cases, I do feel like, I usually start them. I do a lot of MARPE in my practice, so like adult expansion with the MARPE custom tabs and stuff, everything. So for those patients, anyways, I prefer to start with expanders, and then I transition them to whatever treatment modality I choose. And I feel at that point, it becomes such an easy choice for these patients to pick InSmile because things just work. So and sometimes I wouldn't go for like, there's like a big space, like a huge space, because yeah, and I'll show some cases too where I've still done it because there are patients, again, like there's the demand there. And I'm more of I belong to that category of the patient, orthodontist, where I'm like, okay, I want you to get the best result, but I also want you to enjoy the journey. Like I don't want you to be miserable in regular braces and you absolutely hate regular braces and you don't enjoy the journey at all. Like I'll work with you. And again, at this point, I want to mention, like, we're all orthodontists. We've learned different ways and different ways of combining treatments. There have been so many times that I've put sectional braces along with aligners. We've used additional adjunct appliances or accessories, or things like a nance or a palatal expander before doing aligners or braces, or we've done sectional, as we mentioned, or some sort of a spring, like a CS spring or something. So why are we limiting ourselves that, okay, this is a class 2 case or a class 3 case, and I'm not going to use InSmile? Why don't we use whatever accessory is going to actually solve that bite issue or bite situation, and then go to InSmile? Something that I'll be very careful about, with which in my eyes does not make a very good InSmile case, would be if the patient has like perio issues or perio concerns. Just because I do feel like if you're very prone to like periodontal issues and your hygiene is not good and you have puffy inflamed gums, you can create like it's not that it's going to create more issues, but it's not going to get any better. And I feel like bad hygiene from the lingual side will actually make your gums really puffy and bleedy, and then it just becomes harder to put brackets on and all that stuff because the gums are like really puffy at that point. um, and then I feel like there's a big category of patients which in my office would not be candidates for InSmile, would be if I have to convince them, that if I have to like really pressure them into, hey, get this lingual treatment done because I do it so well, or I feel like you're a best candidate, but they're not sold on it. It is, of course, it depends a lot on how we present the case and how we make them believe in the treatment. Like it's a lot of it, but all of us, I believe, are have learned that trick. Like we know how to sell. So if you've known the art of selling, and we've tried everything to convince somebody that you're a great candidate for this kind of treatment modality, but if they're not convinced, don't push them in it. Because if they're not sold on it, they're going to complain. They're going to complain every single time. And then I just wrote it here, men with tattoos. And the reason I say that is because I've done almost, I think I'm getting very close to like almost 200 cases in InSmile at this point. And I think I've had three patients back out. Out of those three patients, I believe actually all three were men. And they were big men with big tattoos, and but for some reason, I guess they are when it comes to like dental discomfort, they don't do so well. So just a little disclaimer there. So let's talk about marketing. The videos that you see here on the side, those are some of our best working social media ads. And if you look at it, to be honest, like there's nothing super extraordinary about these videos. Like, we were able to create it's a simple video which literally shows the braces, but and the InSmile from inside, honestly. But the amount of traction this little simple thing gets us is amazing. It's like, it's mind-blowing to me how people are just intrigued. Like, we get so many comments and so many people asking, oh, what is this thing? I've never seen something like this before. I want to see what it is. And we've gotten so many patients, so many leads, so many consults that have come to our office and asking for lingual braces, and the daily consults, like we hear this, oh, I don't want braces, I don't trust aligners, I'm on camera, I'm on professional. Like, these are all your InSmile patients. And another thing that I want to mention here is like Smile Direct Club. Like, we know that there is a set of patients who are out there who will not, like, who I don't know what's the right term. Like, are they lazy enough to go to an orthodontist? But they just want to, like, they are scrolling on the screens all the time. They are on social media. They're on Facebook, Instagram, TikTok, YouTube, all of these things. And our social ads, like, if you don't grab the attention from, within a few seconds, you've kind of lost them. And I do feel like this, just showing this little video of like opening up and showing the InSmile, like, it grabs the attention. It's such a good hook for, for the people who are into social media ads. Like, they'll understand like a hook. It opens up the such wide variety of patients, for us, and who are not necessarily meant for braces or aligners. And also, one thing that we did, like, or we did for our social media marketing, at least, we don't put like any offers like, hey, $500 off, $1,000 off, or whatever for aligner treatment or whatever. I feel like there's enough attention grab with these videos that we were able to convert a lot of these leads, because everybody, like literally everybody's marketing you, or most people, I shouldn't say everybody, but a lot of orthodontic people, including us in the beginning when we were doing some, when we didn't know any better, we would have these big offers like $500 off braces or $1,000 off aligner treatment. That that's not enticing to people anymore. So you need to present something which is very unique. And I felt like this was like really good for us and provided that unique preposition there for us. Now let's talk about some numbers here. Um, in gist of this things, like, I absolutely believe that you can absolutely charge a very premium price. In our practice, we don't charge super high. Like, we charge pretty comparable, or just a few $100s more than regular braces or aligner treatment. And that's just because I guess we've streamlined our systems well enough, and we kind of started doing it because we wanted to keep the barrier of entry like really low, um, for people to get started with InSmile treatment. So we're not crazy in number there, but I do feel like the profitability is there in this treatment because there's less number of appointments. I usually say that, hey, to my patients too, like, hey, there are two sets of wires. Each wire run around 3 to 4 months, and it flows really well. It's completely indirect bonding. Anybody who's done indirect bonding, it's a complete doctorless bonding. My assistants are really well trained to do the whole bonding put the wires in and out. Like my literal chair time is 2 minutes. And that too, I'm like just making sure that the patient understands what they're going to expect after getting the braces on. Like I take a look inside the mirror, take a look with the mirror to just make sure that the wire is completely seated. And once I know that the wire is completely seated, I don't even like have to put the gloves on sometimes. Like I just use a mirror to do it, and then I'll just chat with the patient and that's about it. Like literally the whole bonding, I don't sit in the chair. So I feel like the whole it's a very high ROI per visit for the doctors. You can absolutely charge higher than aligners and braces. Per patient, you'll have much more profitability. And there's a so basically for your production goals, you'll need to start less number of patients. You know, it's a premium pricing, it's a high perceived value too. And also it's rare, it's premium. So if not anybody, especially in your area, if nobody else is offering it and you're the only one who's offering it, absolutely go charge more, you know. So this is just like a revenue example that we kind of figured out. Like even if you do like additional like 4 starts a month, and let's say you're charging $7,000 for those 4 starts, that's an additional 28,000 per month. So over a span of a year, you've made almost close to like $336,000 in addition to whatever else you're doing with regular braces or aligners. Nobody's saying that, hey, replace this product with your braces or aligners. Absolutely. You are the doctor, you're the orthodontist. You're going to make the decision which case, you know, again, we talked about the case selection here, but what case is meant for InSmile versus what case you should be doing with something else. And if you've decided that, okay, this is a case that I want to try InSmile, absolutely go and charge $7,000. That's an additional. And then just an example, like let's say you increase that from 4 adult starts per month to like 6 starts. And I mostly use it with adults. You can absolutely use it in permanent dentition. So teenagers are all good too. It's just that not teenagers don't really care about inside braces versus outside unless, you know, there have been a couple in teen patients that I treated, and one of them was mainly because they were a model and mom didn't want to show the teeth braces with teeth and stuff. And it was an adult dentition. Everything worked out really well. But if you're starting about 6 adult cases per month, you're adding almost half a million additional revenue per year. So when you're collecting that money over 2 years, you've grown your practice almost a million. So I feel like if you and I, you know, it's a simple math, but I think it makes sense. Now let's talk about what is the stages or how do we kind of do this. So obviously you've got, you know, initial consultation. We do this comprehensive evaluation. You're going to check everything. Go in and I present all 3 options. I'm going to present them as braces, aligners, and InSmile. Usually, my question to them is like, depending on what their, you know, how their presentation is, if I'm going to do the diagnosis, and if I feel like, okay, they are a candidate for everything or anything would be a good option for them, then I'm going to ask them, okay, do you want a discrete option or are you okay with showing metal in the mouth? And that's my question. If I feel like that's a candidate for all 3 options, if I feel like, okay, this is something that I don't want to do with aligners or don't want to do with InSmile, absolutely go for braces. Don't even give them the other option or tell them that that's not an option in your case. Completely, you're in control there. And then most of the times I feel like the conversion on InSmile is high because that's not an option given in other consoles. People are shopping nowadays, so they are going to different places. So they are not if they're not given this option anywhere but at your place, they're absolutely intrigued. So they're definitely more interested. So patients always love it because it's hidden. There are no trays. They don't have to remove and add. So their confidence level is higher. And so let's say the patient does pick InSmile. Very simple, straightforward process, just like any other workflow, like with aligners or if you're doing the indirect bonding with braces, either even. The first step is just a scan. That's all we need. Okay. We have a very user-friendly platform where you go in. I don't submit the cases. My lead assistant does. She uploads the you know, all the pano, which is the cutout from the CBCT because I use CBCT in my practice, and then we submit you know, there's a direct integration with iTero, by the way, but you can also submit the STL files, of course, and then we upload the pictures, and she fills in the initial prescription form for me as well. So I only get notified when it's already been submitted and worked on by the InSmile team already. Like when it's time for approval is when I get the notification that, hey, it's time to approve. And then I approve it. We work it. Like honestly, the setups are really good. Shout out to Dr. Lee. Like he kind of takes care of all of that stuff. Like I've never had to manage too much of like not too much tweaking needed. And so once at the time of delivery or install appointment, super simple, easy. If your team is comfortable with indirect bonding, they will have no issues with it at all because it's the same process. But even if they're not, I think the learning curve is not super steep. It's like, yes, you are going from the lingual, but the process is still the same. You're still pumicing, etching, priming, bonding, curing, pretty much that. So all of that is super simple and easy. And then, you're just going to see them for your regular appointments. The wire goes in. The tools that come with the wires, I feel like we have our special InSmile kits, and there's only 5 things in it, three of them being mirror, explorer tip, explorer, and like a tweezer, honestly. The rest, there are just two main tools. There's an engager. That's the only thing that needs to be like that kind of pushes the little lockets inside. And then there's, of course, the remover tool, which I feel was like the most amazing thing because it helps removing the bracket wire out of the brackets so easily and the brackets don't break. Like, yes, there was an issue in the earlier design where the brackets will come off when you're trying to remove the wire. Not anymore. So regular appointments, the flow is super simple and easy. We are able to I usually space them out and see them every almost 10 weeks. Very rarely I'll do like 12 or 8. 12, I just feel like it's just too long. I don't want the patient to feel like I forgot about them, basically. And 8 sometimes is like too early. So usual appointment time for my patients is usually 10 weeks. I see them every 10 weeks. The first appointment, it's a quick check. I'm not doing anything. If there is an additional IPR needed, I'll probably do some IPR. I'll chit chat. Okay. We're not changing any wires or anything. I'll go another 10 weeks. And at that point, I'll switch it to wire number 2. So the amount of patients that actually come back at the first appointment after bonding and actually say that they're so amazed and excited about the treatment changes or the smile changes that they're noticing is amazing. I have not had one single patient say, "Oh, I don't notice any change." That doesn't happen. It works really fast. It has a wow effect. Teeth move faster and they move like the front teeth are moving. Like it's not like you have to wait for the back bite to adjust and the front teeth will then start moving. Even the patients who in the beginning, like sometimes, the patients are going to complain. So sometimes, during my consultation, like when they're choosing InSmile or when I'm presenting InSmile and we have our treatment coordinators like kind of going over it, we absolutely go over everything that they're going to experience, which includes, yes, your tongue's going to feel it. Yes, your tongue's going to be in discomfort for a little bit. And no, it won't cut, it won't bleed. There would not be any sort of anything which might make it hurt. There's nothing painful unless and I've never actually had a patient where the tongue bled or cut or caused ulcers unless there was something going on with the patient, like a patient was on some sort of a medication. Or in one situation, she did get a little nick, but that was because the locket was not fully engaged. So if the locket's not engaged, it was kind of hanging up and the tongue kind of rubbed against it and caused it. So if the wire is completely fully engaged and you've made sure that it's all smooth, there's not going to be any issues there. There's something that I always tell them that yes, there will be a little lisp. Now, anything you place inside, including we do expanders, I do a lot of bite plates for a lot of my patients. Whenever I'm doing any of those things which are touching the lingual of the teeth, yes, you have to let them know that there will be some sort of a lisp that'll come, but it does go away. There's a rainbow passage which comes with the box of your case with a case, so you're able to kind of we give it to every patient. We tell them, hey, kind of read it aloud a few times, and your list will get better. Like, will it and everybody is at a different pace on that spectrum. Like some people are like, the moment we put the braces on, they're totally speaking totally fine, there's no issues. And some people, even till the very end, they're like talking a little funny. And I tell them, even though like there'll be a little lisp that may remain other people will still be able to understand you. I have one patient who actually speaks on the stage. So she actually conducts like conferences and, shows and things. And she's like, I usually, whenever somebody kind of stops and talks to me, I tell them already that, hey, if you feel like I'm talking funny or I'm slurring a little bit, it's because I'm wearing braces. And she is absolutely, she tells like everybody is always like asking, what are you wearing? You're actually wearing braces? I had no idea. So those are some things that I'll always like mention that, hey, be aware that this may happen, this may not happen, but we have the systems and protocols all in place. So emergencies, of course, brackets can break. That can happen with regular braces. The one thing that I find about broken bracket with InSmile is sometimes like if the bracket usually if the bracket does come off, one, if it's in the middle section, it's kind of hanging on because the rest of the teeth are holding it. So even though it's moving, it's usually not an issue to the patient. So most of the times, even if it happens over the weekend, like patients are usually able to come back on a Monday and we're able to get it. Touch wood, I've never been asked to come over a weekend or a Saturday or a Sunday to clip a wire or take care of the bracket by myself. Like that has not happened because most of the time, if it's in the middle section, it'll move, but it'll kind of stay there. The wire is holding it. And if it's a very terminal tooth, that's where sometimes they'll say like, hey, the wire's kind of off and it's bothering me. But the thing about the loops is that at that point, because it broke from the tooth, if it's a terminal tooth, I've seen most of the times it cuts off by itself in a very clean cut, like to the point that sometimes I've asked these patients, like, hey, why don't you come in and I'll clip the wire? And it's already clipped and it's such a clean cut by itself. And I don't know if it's a coincidence or there's some sort of like a design thing, but it's such a clean cut that I wouldn't have been able to cut it that clean. Like, and then they're like, oh, you know what? Yeah, it came off, but it's not bothering me anymore. So that's that. um you know I always tell patients like your water flosser is going to be your best friend. That's going to help take care of all the food that's going to get stuck. And yes, the food will get stuck. It does get stuck even in with regular braces. So you just have to make sure that you maintain your hygiene really well. And then of course we want to make sure that if there's any, you have the wax handy, so you give them a lot of wax, give them a lot of TLC. You kind of like, it's mostly the TLC that's needed for these patients. So some of the objections that I've heard from a lot of some of my, orthodontist friends who've like asked us is, "Hey, it's hard. Like, we discussed that along the grow, but like then sometimes like, is it hard? It's hard to implement, or how hard is it as an orthodontist to work on the patient?" Like, it was very interesting because I was like deep into InSmile and I was talking to somebody who said like, "Oh, is your back still okay? Are you not like hurting your back already?" And that made me realize that, oh, was my back supposed to hurt? Like, and then I realized, yeah, it's a lingual treatment. Like, I'm supposed to look under to kind of do all this. But the fact is that my doctor, as a doctor time, or even for my assistants, to be honest, at this point, they're able to finish a bonding. And bonding, you're not kind of bending too much, it's kind of straight up. And then, but even for wires and putting the lower lingual wire is super easy, but upper lingual also, it doesn't take more than like, even from a non-trained assistant who's like 2 years into the practice, she's able to do it under 10 minutes, which is, to be honest, is not that long of a time. So it's actually pretty okay. Sometimes I feel like I bend my back a lot more if I'm doing like some kind of like lingual ramps, um, or like removing them. So I do feel like it's very manageable, especially with the workflow, like making sure that we're able to kind of uh, do it in our practice flow of the practice. How do we manage all of that? Yes, of course, in the beginning I was scheduling a lot more time, like 90 minutes for bondings and all of that stuff. I was doing one arch at a time. Now I'm at a point where I'm doing both arches together. 60 minutes the patient is in and out, just like any other bonding. So of course it takes time, it takes a lot of practice. And yes, there is a learning curve, but it's not that steep as people perceive it to be. And then is the demand real? Like some people, like I read in a lot of like groups and stuff as well, like, hey, if that patient is that vain that they don't want aligners or they can't deal with aligners and they don't want braces, I don't want those patients. And I'm like, sure, I'll take those. I'll take all those patients any day, every day. Because one, it'll help my practice. These patients are actually looking for something, they're looking for a solution, they're a really good mouthpiece for your practice. Like we've had so many of our InSmile patients refer more patients for InSmile to us. And do I start them all in InSmile? Maybe not. Like again, case selection is in my hands. So I'll see if you're a good candidate for it and I'll do it. If you want it, I mean, I'll show some cases. I've done some crazy cases. I've not kind of shied away from a lot of it, which again, because you can, but there is a huge demand. There is a big population sector there that's looking for this option. And then do patients accept? I think the patient acceptance for lingual braces especially in our practice is pretty high. I feel like these patients, like they come in and we've trained our records. So we have a records tech who will take pictures and x-rays before the patient is sent into the TC. And then my records room is right opposite to the doctor's room. So if I'm sitting there, I can actually hear the conversation that's happening in the records room. And most of the time, my records tech is asking, "Hey, what's bring you in today? What are you interested in?" And I kid you not, I feel like almost 90% of my adult patients are out asking for, I saw the ad for the lingual braces. I'm here for the lingual braces. When they're coming in for lingual braces, they have done their research, just like my MARPI patients do. I do a lot of MARPIs too. So I feel like those airway patients, MARPI patients, they're like, they know that what they want and why they want. They've done their research. You don't, so selling is actually super easy. So my conversion rate on these patients are really high. So I feel like the demand is there. And I feel like the future should not be, oh, is it going to be aligners versus braces? I feel like we should be offering all the options. And why not? Why should we restrict ourselves? So now I'm going to go into some of the cases that I've done. So this is like our bread and butter simple case for InSmile that I think works really well, where the treatment is done in 12 months. Honestly, like most of these patients, I give them 9 to 12 months and they're pretty much done before. Sometimes I just like keep the wire in or keep it in more for like I guess financial reasons because like you're charging $7,000 and you're doing it over a year time. You want to collect the money, like at least a major chunk of it. So this is one of my patient's mom. Actually, we treated the daughter, teenage daughter, and mom was like very conscious about her smile, never had the flared out teeth. Works out beautifully well. So it's just like you put it in, the wires did it, no tweaking needed. I don't think I did a DE for this, which is kind of like a refinement in your terms, but this pictures, and you can see that the gums are inflamed on the lingual side because these pictures were taken on the day of T-band. And there was another thing that somebody mentioned, which was one of the objections given to lingual braces was like, oh, the finishing is not as good, or I don't like the finishes. And to that, my answer was one, I don't think the finishes are as bad, especially if the treatment was, like if you've kind of been very particular about things, the finishes are actually not that bad. But even if I feel like there are so many times that we keep tweaking our aligner patients and we give like active retainers to some of our braces patients. So why do we shy away from like, oh, I don't want to waste money here and there, but you kind of do that for your regular braces too. So for lingual braces, why are we so hesitant? Will be my argument to that. But also to say that most of the times I feel like my finishes in lingual braces within Smile is very comparable to aligners, very comparable where I feel like I don't need to tweak much things. This is another patient that we did where she actually had braces before. So some of these are like the easy 12-month-old kind of cases where we see that she had braces, she had a fixed retainer, and that fixed retainer kind of broke. Actually did not break, sorry, but we started seeing the torque issues happening. And this is one of the cases that simply tells the torque control where people are like, oh, how do you control the torque? If the torque control happened on that lower canine such beautifully well, and it works. It absolutely works there. So this is kind of what happened. Now this is the next case that I'm going to show right here. This is so another thing that this particular girl, she's actually an attorney. um, she came with very deep bite, lot of crowding, absolutely refused braces. Braces was my first choice. She said, I will only do discreet option, otherwise I would not do anything. I at that time thought that she is not a candidate for InSmile because there was too much crowding and too much going on and very deep bite. So we actually did start her on clear aligners, and I believe it was Invisalign, and she achieved some results. I'll show you here, and I know that I did the activation here. So where we see here is like the left side of the screen. That is when I actually moved her. So we dragged the treatment. So she had aligners first, clear aligners first, and she tried it for a year. I kept telling her to wear her aligners. She could not. She tried, was not very good at wearing. At this point, she gave up and she's like, okay, I can't do this. And we transferred her over to InSmile. And from that point onwards, the InSmile worked well. So I feel like, again, as orthodontists, like if we have transitioned regular, like if you have some of these patients where the cases are hard and you want to transition them over to braces, give them the option of lingual braces as well. Why not? So that works really well. Now, this is another patient who has been actually my old patient in InSmile. She's been 69 years old at the time she started. A lot of anterior crowding, and um, she literally on my face told me, I don't think you can do this. She literally said that I don't want aligners. I believe that she tried aligners with her general dentist and did not work. And so she absolutely refused to do aligners, but she would not want braces either. So we did InSmile for her. And she was thrilled, did amazing. In this, I do want you to pay attention to the opening loops that we have. So InSmile technology has these opening loops where we're able to actually use them kind of like an open coil to make space. And I don't shy away from doing IPR. Like I do a lot of IPR. I'm a PITS provider, so I'm a PITS user in my practice. So I do a lot of IPR and shaping of the teeth in my for my regular braces patients as well. So we did good amount of IPR here, but we were able to make the spaces for all the teeth and line them all up. So this was kind of her for initial, during treatment, to the final, to the very bottom. So all of that kind of settled in very nicely. And then this is your another patient. This is my patients, typical patients that come in. We have crowding, upper lower, we've got some bite issues. Again, something that I don't shy away from doing is using rubber bands or elastics with my treatment. Like I will put in the buttons. So I do tell them that, hey, the buttons with the rubber bands are going to go outside and you will have to wear them, just as I would prescribe them for aligners or for regular braces. I do use rubber bands. I do wait to go into Smart Wire 2 so that if there are any side effects that were going to happen, they are minimized because the wire is a little bit more thicker. And that helps me. So I know that we're changing some terms here, so they might need to correct me on that. So this is another one of the case, and this was actually one of my first extraction cases that I did with InSmile, and Dr. Lee helped me kind of plan this earlier on. So we used an end. So this patient actually came in with her chief complaint of flared incisors and of course class 2 and large overjet. She Earlier she wanted, so when I signed her up for InSmile, she just wanted, I told her, hey, either surgery or extractions of upper fours, or with which will I'll do with braces, or we just fix straighten up your teeth, and that's about it. So she absolutely came for lingual braces and did not want to do anything else. And I had told her that if I'm doing, if I'm not correcting your overjet, so I signed her up for InSmile in the beginning with the intention of not correcting her overjet and just lining the teeth up. And then she told her she was okay with it, signed up for her InSmile, scanned the case for InSmile, and then she went to her dentist, and the dentist was like, "Why would you not correct your overjet? That's the main thing that needs to be fixed in your bite." So she came back and she's like, "I want to fix my overjet." So I said, "Okay, sure. Well, we'll have to take two teeth out." And we did. So we did the upper 5 extractions for her. We used a NANS while we were closing the initial space and distalizing her upper 4s. And I used some buccal braces with it. Again, like as orthodontists, we know how to use and combine different tools for our advantage. So which is what we did. And then After most of the space was closed, I transitioned her and scanned her again for full InSmile, all around 7 to 7. And we were able to finish her case. It took 31 months, but that's because she also got pregnant during the treatment, had her baby. And I wanted to put in the picture of herself as well, but I couldn't because by the time she got her braces off, she was pregnant again for with her second child. So there's that. Now this is another one of the patients. Now this patient, completely neglected oral hygiene. Again, very professional. Again, worked in really nice, had a great job, professional, all of that stuff, but ignored the oral hygiene after he said did not visit the dentist after turned 18. Like once he was out of parents' house, did not go to dentist. Came to me I think he was around, I think, or late 20s probably when we saw him. Very severe lower crowding. So yes, we did take the lower incisor out for him. And honestly, some of these super extra crowded cases where we are taking teeth out for the crowding reasons, they are such easy, smooth cases with InSmile. Works beautifully, and the space closure, the torque control, the teeth, everything is very amazing. So the profitability on these cases goes really high up because you're not like sitting there and trying to close spaces and having them come back every 4 weeks because you have to like retie the chain every single time. The wires are working naturally; they're working all the time. So that's that. This is one of the other super simple 6 months. So this was like less than 6 month case where she had a relapse, absolutely refused aligners, and wanted to fix it. Her dentist, who does a lot of Invisalign, this was sent by the dentist. So this is one of the cases that I got from this dentist, which stopped referring the moment he hired an associate who was really big on Invisalign. I believe Spark actually, not even Invisalign. And then they stopped referring even a single case. And then I got one referral for them, and I'm like, why? And this was the reason because they tried aligners for her. She did not wear, and she said, I don't want to wear them. 6 months, and this was treated. She was amazingly very happy. And again, I charge her the full fee. Like it's not, and to them, my thing is whether I'm taking 6 months or 12 months, my lab fee is still the same. So my cost of doing the treatment and then my price to the patient is the same. And these patients will pay. They know what they're getting. They know why they're being charged what they're being charged because then they choose themselves. Like you're not forcing them to choose something. So I feel like this is such a big revenue builder for the practices as well. So that is that. So this was quick and easy, and I feel like I am going to give it to Dr. Schwartz now and see if we have any questions that needs to be answered.
Okay, anybody have any questions for Dr. Sodi?
So if you have any questions, you can actually write it
Hi.
in the Q&A box on the bottom of the screen of the Zoom.
Yeah, I don't see any questions here, Robert. Well, Dr. Sodi, while people are thinking of questions, thank you so much. Great cases and appreciate your insight into how it's grown your practice. And I'm super happy that you're a partner with us moving forward in the years to come. And I see a lot of names out there that have come back. And again, I appreciate you being supportive of the company, and we're going to be doing some great things in the future. There's going to be a few changes coming along, especially with the wires. The wire is going to change a little bit where we're going to reduce a tremendous amount of wire breakages that we usually have with sometimes in the smart wire, the 014 wire, the first wire. So that'll be coming along, and some other the mini tab will change a little bit, which will work a lot better for you in your practice. Less visits to get uncrowded cases, which will be great. And also, I don't know if everybody's aware, but we have also a 4 to 4 option now for relapse cases with a much lower lab fee of $600. So that's been a pretty big, I've been doing that in my office and basically finished the visits in two visits, basically. One to put them on, one to change it, and then I guess the third visit obviously would be to take them off. So things are great. I can't complain. I appreciate everyone supporting us. Um, and thank you for your time this evening. And thank you, Dr. Sodi. Let's just see if there's no other questions. And I appreciate your time, Dr. Sodi, and so much. And
Thank you.
anything else, Dr. Lee? Would you like to say anything?
No, just again, thank you, Dr. Sodi. It was an amazing presentation. And we'll see everyone in the next webinar.
Yep. Thank you. Have a great
All right.
evening.
Thank you.
Thank you.